I've been here in Thailand about 8 years now. Came from the US and did all my training there and worked there, and I basically have specialized in integrative oncology, so I take care of people with usually late stage cancer. And the interesting thing about cancer and viruses is that they're really more than cousins, they're siblings. In fact, many of the cancers, many cancers are related to viruses, and I think that someday we might find out that all cancers are related to some sort of microbial infection. So you all know about HPV, right, for women, cervical cancer. Well, you can get that same cancer in your mouth, in your throat. It's called nasopharyngeal cancer. There's Epstein-Barr virus, which causes lymphomas and nasopharyngeal cancer. There's hepatitis viruses, which cause liver cancer. Anyway, so and I'm sure there are more. And there's some Japanese researchers who think that all cancers actually have something called an alpha proteobacterium in there, so anyway, they're very related, and so this COVID thing is worth talking about. And the one thing I want to that I hope you go away with is to get rid of the fear. The fear is a hype. Okay, it's a hype, and the ulterior motives we won't get into at this point, because but any of you that have been had open minds and looking at the world in the last 40 years, you know what's happening. But in any case, so just to give you context, the common cold that we see every year is basically rhinoviruses, and that's about 50% of them. The other ones that cause colds are coronaviruses, respiratory syncytial virus, influenza, parainfluenza. The coronavirus, usually in the winter and early spring, and it's the cause of about 20% of the common colds, and there are more than 30 kinds. Only 3 or 4 of them affect people. The coronavirus, anyway, so symptoms, we all know about the symptoms. The one thing to distinguish a cold from influenza, which you could consider this COVID-19 as sort of more like an influenza, is fever, the absence of fever. In a cold, you don't usually get a fever. You might have a mild fever, like 37. How many people here are Fahrenheit minded? Yeah, Fahrenheit minded. So, up maybe about 99. But anyway, it enters your body through your mouth, eyes, nose. So that's why everyone's, worried about wearing masks, etc. It lasts 7 to 10 days. Here's the coronavirus. And this is for, the common symptoms include fever. And that's one of the distinguishing symptoms. The thing about headache that's interesting, on the Thai news, like us, we Farang, we don't get the news of Thailand. They don't tell us. Is there a news channel that has us? No. There's no news channel. But anyway, if you once you learn Thai and you can listen to it. Yesterday there was a doctor on, a Thai doctor who said somebody came into some hospital with nothing but a severe headache, and it turned out that it turned out to be COVID-19. Now, I'm not so sure if I believe that, because I don't know how good the science was, but he said he used PCR testing, which is very good testing, polymerase chain reaction, which is a way of looking at the real details of an organism. So if it's true, then that would mean that it had mutated. Because I'll show you here, this virus, this coronavirus, is just like the hepatitis virus, will not affect your lungs, will not affect your brain, it will affect your liver. HPV will only affect mucosal areas like here and here, right? So each virus is what they call a tropism. In other words, it is attracted to certain organs. So that means if this guy actually did get an encephalitis, which is an inflammation of the brain, from the COVID, that means it's changed. So I don't, I just don't know. It's hard to get the truth nowadays, as you know. Anyway, runny nose, sore throat, headache, fever, cough, a feeling of malaise. Anyway, it usually results, the cause of death is usually respiratory distress, respiratory failure. The complications of a common cold are mild. Ear infections, asthma, etc. They're all due to secondary bacterial infections. So you get a cold, it weakens your throat, it weakens your, the virus just weakens you, and so now bacteria enter because it's weak, and you wind up getting a pneumonia. That would be a serious complication. If it happens up here, it goes to your middle ear, you get an ear infection. Kids get that a lot. And then as you see, you can also get pneumonia and bronchitis. Very rare, very rare. So as I said, the main differences with these, between flu and cold, is that flu only involves the influenza virus, A and B. And you feel bad quickly and you get a high fever. Otherwise you got a cold. Now, MERS and SARS, which we saw a few years ago, are coronaviruses. And now we're calling this novel coronavirus a new strain that had not been identified previously in humans. It's a zoonotic virus, which means that it affects animals, and it goes back and forth between animals and humans. Now, one thing about nature is not prejudiced. In nature, most things happen in nature slowly. For example, you have a beautiful flower, right? And that didn't happen overnight. If you dig the soil up, you'll find the roots have been struggling for a while to get to that point. So in nature, things happen slowly. So to have a new mutation immediately infect the whole world just doesn't sort of follow natural processes. So the theory that's that's presented to us is that it came from bats and then these other weird animals. I don't know if you ever saw a picture of one, but they look prehistoric. And so it was from bats to humans, and now humans to humans. 81% are mild. In other words, and the 14% severely ill. Of those 14%, 4.7 become critically ill, and then they die. And the fatality rate, 3.4%. 100% of the fatalities are only in the people that are critically ill. Okay? Most of the cases of people that are dying are elderly, but not just elderly. You can be a robust old person, or you can be a sick old person. You can be a sick young person, so it really doesn't matter. So if you have a compromised immune system, if you have cancer, if you've got HIV, if you've got any other really severe chronic illness, like an old person with congestive heart failure, an old person with emphysema, and things like that. But in general, it's something that we can overcome, and most people do. 80% of the people do. Now, worldwide now, we have 113,000 cases and 4,000 deaths. That gives us a global mortality rate of 3.53%. In Thailand now, only 50 cases, 1 fatality, which is a 2% fatality rate. So it's not a lot, in spite of the fact that I think recently the Prime Minister loosened the restrictions, and now there's a lot of Chinese coming back. Somebody was at the airport the other day and said you didn't turn that off, did you? Can you leave it on a little bit? If you no, I know that's low thyroid. You need some thyroid. No, okay. Yeah, that's okay. That's okay. No, how about in between, moderate? Okay, I'm trying. But anyway, for the most part, it's not a big deal if you get it. It's probably the same as getting a cold. If you're a regular healthy person, don't worry about it. Yeah, I'm always reticent about telling what I know to be the truth, so. I don't know who I'm talking to, so. But anyway, the goal is to get us scared. Scared enough to do what? To stand in line for vaccines. When you get 90% of the planet in line for vaccines. We also know that Wuhan is where in October they started 5G. The most deaths are in Wuhan. Okay, so you know. So anyway, so the way that this virus works, and it's the way that all viruses work actually, is that the reason it has a tropism for a specific organ is because that organ has a receptor for a protein spike that is on the bacteria. So that receptor fits in and then it connects. Now the thing about viruses is you can't kill them because they're not alive. They don't eat, they don't drink, they don't breathe, they can't even have babies. Right? They don't do any of that stuff. They are the ultimate parasite. Basically, they connect to a cell through that receptor and then some enzymes allow it to enter the cell, and then once it gets in, the coat, the protein coat just falls off, and now this little fragment of DNA, they have enzymes that edit it into your DNA. So now your DNA, your cellular machinery, reproduces the virus, and it stops doing its own work. So if it was a heart cell, it stops being a heart. It just produces virus. If it was a liver cell, it does that. Okay, so that's how viruses work. That's what they are. You know, if one would think, you know, because everything in nature exists because it's necessary, right? Nature is a perfect system. Everything is necessary. So the question is, what is the necessity really of viruses, if you think about it? And it's probably to edit genomes and things like that. But who knows? God knows. We'll never figure it.
I have a question.
Yeah.
What about this possibility about how it's mutating?
Yeah.
Do you think it's making it a lot stronger?
Yeah. That's the problem. If the thing yesterday was true, the story I heard yesterday from the Thai doctor that it affected the brain and caused an encephalitis, that would mean it's not, that particular strain is not attracted to lungs, but rather the brain. But I just don't know if that's true, because what can happen is one of the things that happens in, one of the final events for people who die from this virus is that it stimulates the immune system. Now, usually the immune system is only active against that part of the body that's sick. Okay, but when it loses that specificity and just goes body-wide, you get a total body inflammation, and you get what's called a cytokine storm, and the whole body gets inflamed and gets sick. So if that's what happened, then that would make sense. That's just how it works. So, but yeah, it'll probably mutate, and who knows? It may have been designed that way.
One more question. Is it true? Do you have any belief about the fact that it has to do with your emotions?
No, that's a good point. We'll talk about that when we get to immunity. That's a very important point. So remind me if somehow I forget. Anyway, so this is what I was just talking about. You know, it connects, gets in there, and then basically this DNA goes in. Right, and that's just another pictorial of it. So once the virus gets into the cell, it starts producing these things that stick up on the surface, and that's what the immune system sees. So the reason flus take a little longer for you to develop an immune response, they'll last 2 to 3 weeks rather than 1 week like a cold, is because it takes longer to get these guys up, before they're expressed. So this COVID-19 is attracted to lungs, and the two types of cells that it likes are the cilia and the mucinous cells. So in the lungs, the lining of the lungs, you've got the cilia. I don't know if here's a picture of them, like that. Okay, they're like a conveyor belt, and they're going up. So if anything, if you breathe in something that was a large particle or an organism, or you aspirated by accident your food or whatever, it's pushed up with the cilia. One of the things that smoking does is it paralyzes those. So you lose that part of defense. So and right next to cilia, you'll see mucus cells. And mucus cells are, as you know, mucus is sticky, and that's the whole point. So it goes in, and the conveyor belt's going this way, and it gets stuck on the mucus. So mucus is good. But those are the two cells that are affected, right? So it'll destroy those cells. So when it destroys those cells, you've really lost your defense in your lungs. And this is just what we said before, but as soon as those little things stick out on the cell surface, right, and they're called antigens, they appear on the membrane, that activates the innate immune system, which includes interferon and natural killer cells. Okay, so and there's another cell called macrophages. Okay, these are part of the innate immune system. There's two kinds. There's the innate and the adaptive immune system. The innate immune system is that part of your immune system that doesn't need any instruction. Okay, it'll immediately find something that's not supposed to be there and go after it. Okay, the adaptive immune system is the one that has to be taught. Now it's very powerful, and those are the activated T cells and stuff like that. But it takes a few days usually. That's why if you ever got a TB test and they tell you to come back in 2 or 3 days because they want to see if you have an adaptive, and that means you've already been exposed. So anyway, interferon is a really powerful cytokine. A cytokine, simple. Cyto means cell, and kine is something that's produced. So it's just something produced by a cell. It's called a cytokine. So interferons and then activated natural killer cells are the first guys on the scene that help you, or that begin your immune process. Then you get your CD4s, your helper cells, and your helper cells and your T4 and your T8. Remember, this is the one that gets attacked by AIDS, HIV, goes after T4. So the CD8s are the ones that actually they become the activated lymphocytes that kill. All of this stuff happens with cancer as well. It's really the same response. So here we see that the innate response happens within the first 3 days, and it takes around day 7 to finish your acquired response. So now you have a full attack on it. You got the T cells, you got the macrophages, you got the dendritic cells, you've got the natural killer cells. They're all there, and then nothing can survive it. Which brings us to the obvious conclusion that the only way to protect yourself is to have a healthy immune system. Okay, there's no amount of anything. For example, if someone walked in here right now with a cold and kept sneezing, we all got exposed. Maybe 30% of us get sick and the rest don't. So was it the germ? No, it was the environment, the soil, the milieu, and it's always that. You have a tomato seed, you plant it in the desert, you won't be eating tomatoes. So it's always the soil, and the soil is yours. You're the gardener. Okay, so that's it. So you don't have to look for anything outside. You just have to have a strong immune system. So we'll talk about how to strengthen your immune system, because that's really the answer. Now, what happens, like I said, in the with the COVID, and the reason we're seeing people die, and the same thing with flu. I forget I forget the number, but there's 50,000 people have died from the flu, and we're not talking about it. We're talking about this. Anyway, what's in the news is usually, you must know by now, is the distraction to keep you from looking at what's really happening behind the scenes. So anyway, the normal immune response is usually confined to the infected areas. But one of the things this virus does is it causes it to spread out, and then now your immune system is attacking everything, right? And so when this happens, you go into the third stage, and you wind up with getting a respiratory failure and pneumonia. The same thing that happens to SARS. Anyway, it's called a cytokine storm. And when the cytokine are all these inflammatory chemicals that are produced. And when they get released throughout your whole body, you wind up getting multiple organ failure. That's when your immune system goes crazy, when it loses its specificity. So currently there's no treatment, and when they say no treatment, they mean no drugs. There is treatment, but it's not a drug that you can sell, so it's called no treatment. For example, one of the things they would call a treatment is acyclovir. If anyone gets herpes, which is very common, acyclovir specifically goes after herpes viruses, which includes varicella, which includes shingles. And then the influenza ones, Tamiflu. Anyway, basically what they do is they block the virus from entering the cell. You can't kill a virus. It's not alive. So if you block it from getting in the cell, none of that process will happen, and that's what they do. So unlike antibiotics, antivirals do not kill. So the only treatment they have now is supportive care, which means they give you IVs and whatever. The other thing they do, which is, it doesn't border on insanity, it is insanity, and that is they give you things to get rid of your fever. The reason we get a fever is because the enzymes in our immune system function best at 40.5, 39.5 to 40.5, or at around 103 Fahrenheit, 0.5. Okay, so when we get an invasion of some sort or trauma, the body generates a fever, and that recruits the immune system. So you never want to take anything to get rid of that. You know, if you've got a child, you cool them off with a wet towel, things like that. But you don't give them a drug to paralyze their febrile response. Okay, because that's important. So. So symptomatic support, you know, they get rid of the pain and the fever. They get rid of the messages. Remember, symptoms are messages. You get rid of the messages and you won't know what happened. Suppose you had a really effective pain reliever and you took it and you went to sleep, fell asleep near the fire. In the morning you woke up with no legs. Okay, so it's important to have pain. It's important to have these symptoms. You know, what is pain telling you to do? Stop. Whatever it is you're doing, stop. All right, so we really don't want to suppress symptoms. We want to get to the reason why the body is doing that. Because remember, the body never makes mistakes. It can't. The body is from nature, designed by God. It's absolutely perfect. And it operates under the law of necessity. Nature is not immoral, is not driven by morality. Water doesn't go downhill because it's good. It goes downhill because it's necessary. So, you know. So understand, if your body's doing something, it's because it's necessary, right? You're eating too much pasta, bread, potato, cake, got too much sugar in your blood. Your cells are smarter than you, so they become insulin resistant, so they don't have to eat all that glucose. You go to the doctor, he says, aha, you have a disease called diabetes, insulin resistance. No, that's your body adapting to your mistake. So what do? Take a drug? No. Stop eating this pasta, bread, blah, blah, blah. Right. Anyway, and every disease that you can name is your body adapting to an unfortunate situation. And you just need to change it so your body no longer needs to adapt. So the whole disease myth, basically, is what the medical profession relies on. All right, you go to them and they give you the magic potion. Anyway, so chloroquine is one drug they are finding. This is what they use for malaria. But again, it does similar thing. It blocks the virus from entering. Anyway, it was found to be successful with SARS. So they've had some good results with some patients in China. So basically, chloroquine is the only real drug they have right now. And you know, right now the drug companies are busy looking for drugs, etc. What they're ignoring is that we already have something that works really well. Now, it's called ascorbic acid or vitamin C. Okay? Ascorbic acid is a fundamental molecule that's necessary in all living organisms. Every bacterium, every plant, every animal either produces it or their natural diet provides it. So the organism, so for example, dogs, cats, elephants, horses, all produce ascorbic acid, so it's not a vitamin to them. It's a vitamin to primates, guinea pigs, so we fit into the primate category. So, and why? Because in our normal healthy diet, we would be eating enough of it. So our cousins in the jungle, the gorillas and chimps, are eating 20 times more plants, fresh plants. And so they're getting enough ascorbic acids that they don't need to get supplements. So anyway, so the normal functions, this is, let me see, do I show you? Yeah, okay. So what happens, vitamin C is an antioxidant, which means it's an electron donor. When it gets, when it gets and runs into iron, it loans an electron to the iron, so it changes from ferric to ferrous, and produces superoxide, hydrogen peroxide, and the hydroxyl radical. These are very potent killers, and they kill things. But our body uses that to make adrenaline. Our body uses that to make thyroid. Our body uses that in many it's used in our cells. That's how we make energy. So oxidation is not just a bad thing. It's a necessary thing, right? But our white blood cells use it to kill bacteria and stuff like that. Anyway, that's called the Fenton reaction. So vitamin C also maintains normal connective tissue, wound healing. It makes all these hormones, neurotransmitters. I mean, it's an essential element. We all have what's called chronic subclinical scurvy because we don't get enough vitamin C. All right? Even if you're a vegetarian, but you're probably still not eating enough, because most people forget that if you're a vegetarian, the root word is vegetable. They actually become pastatarians or breaditarians or things like that. So anyway, but if you're eating lots of vegetables, you might get it. But anyway, so we have what's really called chronic subclinical scurvy, which sets our body up for, in all these ways, to just be not healthy. Now, one of the things that happens in the end stage of all diseases, conditions that result, where you die like in the ICU, is you get a systemic inflammatory response syndrome, which is what we were talking about, that this virus, the COVID, does when it makes the immune system be non-specific and it just goes all over the body. So anyway, so the difference between this and septic shock, you know what septic shock is? That's when you get a bacteria in your blood and then your body goes through this whole process. So when they can't find a bacteria in your blood and you're having the same symptoms as septic shock, it's called systemic inflammatory response syndrome. That's what happens with COVID. Now, they have one drug which nobody can pronounce, Xigris. And what does it do? It that works with systemic inflammatory response syndrome. What does it do? It prevents, it blocks a molecule called NF-kappa beta, which is the central molecule in inflammation. If you don't get that molecule, you can't have the inflammatory response. Okay? So this drug blocks that, and it costs a lot of money, but it has side effects. Why? Because it's synthetic. The body doesn't really recognize it. It has other effects. But what is more potent? Well, curcumin from turmeric is probably the most powerful blocker of NF-kappa beta. Vitamin C, also NF-kappa beta. Quercetin. So actually nature already thought of everything.